All right, I do see we are now broadcasting live on YouTube. We will begin the meeting in about 1 minute. I'm going to start recording and I'm muting everyone. So all of the board members have been sent a link to the meeting. You all are live in this link, and we are also broadcasting this simultaneously on YouTube. We've got about 1 minute until start time. People are still buzzing in. Okay, I have 3 o'clock. My name is Sean Crabtree, and I'm the Executive Director of the Lake Cumberland District Health Department. I'm also the Incident Commander of our Department Operations Center that's been called up to deal with the COVID-19 outbreak that's going on in our country and in our community. This is not a business meeting. We won't be taking minutes. We won't be taking votes. This is more of an information exchange from the health department staff in our operations center to the board members to give you all an update of what's going on and what we're doing, and to also give the public an update. We're broadcasting this live. We didn't want to be in any violation of any open meetings laws since everyone's assembled. We're broadcasting it. Let me begin by saying, what is COVID-19? As I understand it, COVID-19 is a coronavirus. Coronavirus is a family of viruses that sometimes they're generally shared among animals. Sometimes they can be transmitted to humans. COVID-19 has recently made the jump from being an animal-only shared virus to one that is shared amongst humans. This particular strain, COVID-19, has never before been in the human species, I guess you would say. So we don't, as humans, we haven't developed any sort of immunity for it. In other words, we're all susceptible to catching it. I suppose unless you have caught it already and recovered from it, you may have some immunity then. Even though the verdict's still out on that, we are assuming that's the way it will work. It wasn't but a few months ago that this virus, as far as we understand it, mutated and made the jump to humans. It mutated after that very quickly and became a human-to-human transmittable disease, and it has spread very quickly to a world epidemic or a pandemic. It's most dangerous, of course, for our senior population and those with compromised immune systems. If you catch it, you have a much greater chance of becoming severely ill. If you're 65 and over and have the various diabetes, heart disease, and so forth, that would cause you to have a compromised immune system. I'm going to go ahead and mute everyone. So it's just me talking now. We have had 2 presumptively confirmed cases in Pulaski County at this point. Dr. Wayman helped me to understand a few minutes ago the difference between a confirmed case and a presumptively confirmed case. And I want to try to clarify that. A confirmed case is a case where the lab work has been sent to the state lab or one of the approved state labs and has been verified at one of those labs. We're calling that a confirmed case. If the case was confirmed at a non-approved state lab, we're calling it a provisionally confirmed case, or presumptively confirmed case, and treating it as if it is confirmed. So we have activated our Department Operations Center. We did that, I don't know, I'm losing track of time, a little over a week ago, maybe a week and a half ago. We've identified leaders for each of our divisions in our operations center, and they will each be giving a report today. Up until we had a confirmed case, our primary strategy in dealing with this was to give out good public information about social distancing, making sure you're washing your hands correctly, stay home if you're sick, of course, avoiding crowds, coughing into your sleeve, and so forth. Now that we've had confirmed cases, our message has to evolve a little bit, at least in Pulaski. If you feel like you have been exposed, we're recommending you stay at home except to get medical care, that you separate yourself from other people in your home, that you call ahead to medical facilities before you seek care. I'm going to mute everyone. Of course, if you're having respiratory distress, severe shortness of breath, we would encourage you to go ahead and get medical treatment sooner. And continuing to encourage people to social distance, cover their coughs, wash their hands, avoid sharing household items, and so forth. Other things that we are doing is we have expanded our capacity to do contact investigations by rolling in additional staff to that function. Contact investigations is something that the health department staff does routinely. We reach out to people who have been exposed to like STDs and their contacts. So this is something we're trained to do. This is a little more challenging because people start being contagious with this. They start transmitting it before they're showing symptoms. So it's more difficult to isolate people before they have exposed others, since they are able to spread it before they show symptoms. In the event, at some point, if we do get a large supply of test kits, we are making all the arrangements to be able to do mass screening, should we be able to get those kits and should we be directed to do so. And again, we're trying to emphasize to the public that if you feel like you need testing, you need to call a medical provider before you go. Make sure that they are doing testing and let them screen you over the phone to make sure that you're a candidate for testing before you show up. One of the cases in Pulaski County had gone to church this immediate last Sunday, and a congregation was exposed. We have asked that congregation to self-quarantine along with some other people, and we're continuing to work that situation. So it is really important that groups not be meeting because this is a very contagious situation and can really grow very rapidly if we're not using appropriate social distancing. Couple things other I will say, our website is up. It's got good information on it. Just go to Lake Cumberland District Health Department, click on the COVID-19 link. You can find about anything you want there. The state has a hotline for anyone who just has general questions about COVID-19. That number is 1-800-722-5725. Again, that's 1-800-722-5725, 1-800-722-5725. If you feel like you've been exposed, the symptoms to watch for are fever, non-productive cough, and respiratory distress. I'm going to allow my command staff and my DOC to just give you some general updates about what we've been doing, so you can have some insights into that. I don't think Amy is able to be here. I think she went to finish dealing with the Strategic National Stockpile. We did have a push from the Strategic National Stockpile come in that has been broken down. The pallets have been delivered or are being delivered to the counties. There's no test kits in it. There's some personal protective equipment, some masks, some gloves, some gowns, and so forth, and that's being divvied out to the medical providers. We didn't get a whole lot of stuff, but we are getting out what we got to try to make sure our medical community is as protected as possible as they are responding. So Stuart, was you going to give Amy's report as far as our planning section?
Yes, and I'll go ahead and give mine in that too. So my name's Stuart Spillman. I'm the Environmental Health Director for the district, also the Chief Enforcement Officer here. I'm going to give you the planning section update and also the enforcement section update. As you can see, maybe behind me, I'm live in the DOC this afternoon. So we are working very closely with planning. Our environmentalists or our inspectors are meeting with community leaders such as the county judge executives and emergency managers, the head of emergency services, hospital administrators, to start our planning and preparation for the drive-through testing when we do get those kits. And we'll also be starting our preparation for our max vaccination clinics. We are sharing guidance for PPE conservation with our healthcare folks and our EMS folks. We have received PPE from the state. We received that yesterday at about 6 o'clock, and we've rolled it out to every county now. Our planning officers have met with emergency managers in their counties, and they'll be distributing that PPE as we can, based on some protocols of priority, such as hospitals being an upper priority, EMS being an upper priority, and then down through there as we have things left. We have pushed back up for some testing kits. Hopefully that'll happen. And we do look for more PPE to come down. Let's see. Okay, and for as far as environmental goes, not only are we the planning liaison people in each county, but we are also the lead enforcement agency to enforce all the governor's mandates, from the restaurant closures, daycare closures, adult center closures, mass gatherings, restaurants and bars. So we've got a lot of stuff to do. So we're very busy right now.
You know, we have developed a cease and desist order to give to businesses that aren't participating or cooperating with the governor's order, and we will be getting that out. We're getting a lot of calls and emails and stuff from the public about places that aren't participating appropriately, cooperating appropriately, and we will get those cease and desist orders out as quick as we can. Anything else, Stuart?
No, that's all.
All right, if you would mute yourself, and I will go to operations. I don't know if Laura is able to be on with us. She was in the middle.
Laura's here in the DOC. She'll be taking my spot.
Thank you. She was helping with contact investigations, so I didn't know if she could pull free. We're glad to have her. She's overseeing our operations branch, clinic operations. Laura, all yours.
All right. I'm Laura Woodrum. I'm the nurse director here at the health department for Lake Cumberland District. We started this week planning with staff to brush up on our skills for contact investigation. We've also been talking about the possibility of mass testing, what that would look like, how we would handle that in each of our counties. I've worked closely with the epidemiologist on possible cases, testing that has been done. We have a referral form to fill out, and we've shared that with several providers for folks that meet criteria to get them approved for State Department of Public Health state lab testing. We are currently doing contact investigation on the Pulaski County case. We've pulled in some additional nurses to do that. That we're finding there's a lot of contacts with the case that was reported yesterday. Dr. Wayman today has finished putting together a packet for providers just to provide some guidance for providers, primary care providers, and some other facilities throughout our district.
All right, in that packet, we're going to have hand delivered to the primary care, the medical facilities that she identified. We're going to hand deliver those. We're going to ask that someone in a management position receive the packet and promise us to make sure the providers actually get those and look at those and read those, so we can all, as public and private health facilities, be cooperating together, working together, and giving the same public messaging. Laura, I don't know if you have this with you. There was several people that was asking about our criteria in our contact investigations, how we're determining what's a more high risk situation versus someone that's less. Do you have that algorithm from the CDC? Can you kind of speak to that?
I don't have that in front of me, but it's a CDC algorithm that classifies people in low risk, medium risk, and high risk. And just off of the top of my head, high risk would be like a caregiver of someone or someone that lived in the patient's home. Medium risk would be social contact. And then it classifies whether or not the person has symptoms. I can tell you most of our contacts fall in the medium risk group. A low risk would be secondary contacts or just being in the same space, but maybe a large space.
All right, thank you, Laura. Ron, are you here with finance? Can you give an update from our finance branch of our DOC, our finance branch?
Yes, sir. I'm Ron Samala. I'm the Director of Administrative Services at the Lake Cumberland District Health Department. And I wanted to give you a little update on some costs so far. This is really just the beginning of some of the costs that are probably going to get pretty massive here for COVID-19. But so far, we spent about $5,000 here at the health department. About $4,700 of that is just for payroll costs for our various employees for all the time they put in so far, and another few hundred for some of the purchases. We expect all of these costs to triple within the next few weeks and just keep growing. The good news is that the state has allowed us to set up a cost center for possible reimbursement of these costs in the future, so we can have some relief, as we do expect these costs to be quite large. I'll also be heading up the purchasing of many of the supplies during this time. So the purchasing of any COVID-19 related materials or any COVID-19 related cost will run through my department, and that'll be top priority of anything we do. Thank you, Sean.
Thank you. And again, just to highlight some of the things, our staff are highly trained in responding to these kinds of things. This is what we do. We know very well how to respond to this. If there's the staff that do contact investigations, they're good at their job. They know what they're doing. We all understand the incident command structure and the operations center. We're able to move staff very quickly into different roles to do different things. So that's all good. We are right now trying to contain the situation in Pulaski County through doing the contact investigations. Should there be, if it gets out in the community very broadly, we would have to shift from containment to more mitigation, public health messaging, and so forth. We are trying to meet with all the county judges and the emergency managers. I have staff assigned to do that just to make sure we're all coordinating everything correctly. I in Pulaski have been working closely with the hospital administrator to make sure that what we're doing in public health aligns with what is going on at the hospital with their precautions and messaging and so forth. We are trying to get the packets out to the medical providers to make sure we're all singing from the same page as much as we can. We're still emphasizing good public health messaging, social distancing, washing your hands often and correctly, covering your cough, staying home if you're sick, and so forth. For my board members, I have a whole lot of you. There's 120 board members across these 10 counties, and each of you may have some suggestions or input. I'm not available enough to be able to receive all that personally. I do want your feedback. You may have good suggestions, but please forward that to your local office manager in your health department. She will send it up the line. I've got someone assigned to take those questions and comments and suggestions and to divvy them out to the right people in our operations center so we can respond quickly and efficiently to whatever questions or concerns that you might have. I'd usually personally take all the information from the board members myself and deal with that. There's just not enough of me to go around at the moment, so I'm having to have some other staff help me with that. Is there anyone else in the Department Operations Center, any of our staff who want to make any comments, any issues we haven't covered? So right now, there's no confirmed cases in any of our other 9 counties other than Pulaski. I would expect we will have confirmed cases in all of our counties before this is over. You know, one thing I will say is if there is a, let's say you're at a ball game and the bleachers collapse and a bunch of people are injured, well, that overwhelms our emergency room. They can't handle all that. We have memorandums of understanding. We don't, but the hospital does, and emergency management, ambulances and things with the surrounding counties to be able to take some of that load. That happens with fire, that happens with medical, ambulance, and in a lot of ways we use these cross-county agreements to be able to support each other. With an event like this, everyone's in the same boat. So, you know, we can't really rely on our neighbors to help us. As communities, we have to step up and be prepared and be ready to handle our own situation. So it's really, really important that the public cooperate with our public health messaging, social distancing, washing your hands. What we're trying to avoid is too many people getting sick too rapidly and needing medical care. If too many people need medical care all at once, they will overwhelm our medical infrastructure, and that's going to be disruptive to care for anyone that needs care, no matter what care that is. If the medical community is overwhelmed, a good efficient care is not going to happen. So if we can, you've heard about flattening the curve. That's what we're trying to do. We're trying to slow the spread of this so that at any point in time, we don't have so many sick people that we've overwhelmed our medical system, so we can get good care to everyone and not overwhelm our medical community. So that's all of the information that I have. I know some of you all probably would like to ask questions, that we just have so many people in here. It's not an efficient way to do that. That doesn't mean I don't want your feedback. Just pass that along to your office manager, and I assure you it'll get to the right person, and we'll get back to you. If you're a physician, watch for those packets. My staff have picked those up as of 1 o'clock. They're taking those back to the counties. My medical director put that together as far as recommendations for the doctors who, like primary care doctors and so forth, people where the patients come in to see you. We're wanting to make sure you get information so we can all be working together. Watch for those packets. Help us with our public health messaging. If you're a physician, you know, what we're recommending is that you ask your patients to call in advance if they're wanting to be tested, to make sure that you are offering the tests. And we would ask that you screen them over the phone to make sure they're a good candidate for testing before you have them come in. There is a limited supply of test kits, so we need to try to preserve those for as long as we can and not use them on folks who are worried. I know in Pulaski County, even the people who were in the church that I talked about, we're only testing or only recommending testing on the folks who were really, really close contacts to this person, sat very close to them, and maybe spent some extended time with them. So, you know, the tests are limited. So we asked you all to help us in that regard. So with that, I think everyone has said everything they want to say. We will probably start doing weekly or so, however often that we can do it in the middle of everything we got going on, but asking all of the local radio and newspapers to come together through a Zoom meeting like this so they can ask us questions and get updates regularly. When we do that, we will probably broadcast that simultaneously on YouTube so the public can hear what's going on too and feel like they're getting regular updates. So with that, if there's no one else in the operations center that wants to give a report, I'm going to go ahead and close out the meeting. Any final comments from any of our leadership in our DOC? Well, thanks to everyone who took your time on short notice to be a part of this meeting. I will end the meeting now. Thank you all very much.